and mute yourself. Our moderator is Lori Muzak-McComb. Lori has been with the foundation for 5 years and leads our major gift team to secure significant gifts for the hospital. She is our Senior Director of Development. Our special guest is Dr. Glynn R. Martin, orthopedic surgeon at Cambridge Memorial Hospital. Dr. Martin is originally from Newfoundland and has been a member of the orthopedic team at CMH since 2015. His primary focus is on total hip and knee replacements, including revision replacements, with secondary focus on knee sports injuries, including ACL reconstructions. Thank you all for joining us this evening. We hope you enjoy our virtual chat with Dr. Martin.
Welcome, everyone, and we're very pleased you could join us this evening. Before we begin our chat with Dr. Martin, I'd like to share a brief update with you about your hospital. Through the generosity of many donors, from children donating their lemonade stand proceeds to those who attend our fundraising events like CMH Reveal and golf tournaments, and capped with a remarkable $500,000 gift in December from a local anonymous donor, Cambridge Memorial Hospital Foundation accomplished our $10 million We Care CMH campaign to equip our new Wing A. As many of you are aware, community dollars fund 100% of the equipment and technology in our hospital. Wing A, opened just prior to pandemic, has been vitally important in our ability to respond. We have a generous community, and we thank everyone tonight for your continued support of our hospital and our incredible staff. You're looking at our new lobby, and as you can see, it's a bright, spacious area full of natural light with spaces designed to connect and relax. Today, renovations to our Wing B are underway as we continue hospital redevelopment. Once complete, CMH will be the most up-to-date hospital in our region. We're excited about the future of the hospital, our programs and services. Today, CMH is offering expanded services to our community, and we have so much to celebrate and be proud of. We are particularly proud of our people, one of whom you will hear from tonight. Recently, we launched our caring programs to help us share, educate, inform, and inspire our community about Cambridge Memorial Hospital. Caring programs provide enlightening information about key programs, the people that provide care, memorable patient stories, and ongoing needs of equipment and technology at CMH. Access to innovative and timely care will help us meet the growing needs of local families. I hope you've seen our ads and social media about the programs, including our recent mental health and addiction services ads running this month. I encourage you to visit our website for more information about our caring programs. And tonight, it's my privilege to chat with Dr. Glynn R. Martin about his role in our orthopedic surgery. We hope our conversation educates, informs, and inspires you. Dr. Martin, it's great to see you. Thank you for being here this evening.
Thank you for inviting me, and welcome to everybody online.
So Dr. Martin, can you start us off by sharing a little bit about yourself and what education and training you have completed to become an orthopedic surgeon?
Sure. I was born and raised in Newfoundland. I didn't come to Ontario until 2014, and my wife joined me 2 years after. She was still finishing her psychiatry training, and we both live here in Cambridge. As for my training, I did most of my training in Newfoundland at Memorial University of Newfoundland. I started off with a Bachelor of Science honors degree, which is a 4-year program. And then I went on to do a Master of Science degree, which is a 2-year program. And then from there, I went to medical school. And medical school in Newfoundland is 4 years. And after 4 years, you decide which specialty you want to do, and I selected orthopedic surgery. And the orthopedic surgery program is a 5-year program. And at the end of the program, I decided I'd like to subspecialize in hip and knee replacements and complex hip and knee replacements and revision replacements. So I came up to London, Ontario at Western, and did a 1-year fellowship at the University Hospital.
Wow. Well, it's clear becoming an orthopedic surgeon is quite a commitment. So what inspired you to choose orthopedics, and how did you end up here at CMH?
Well, I think my first real introduction into orthopedics was actually from my now brother-in-law. He has cerebral palsy, so he's undergone numerous surgeries, orthopedic surgeries as a child. And he actually wasn't able to walk until he was 8 years old. And so just seeing the transformation and the impact orthopedic surgery can have on a child really kind of put orthopedic surgery on the map for me. And then when I further went to medical school, I was kind of naturally gravitated towards orthopedics. I kind of like the hands-on aspect of this area of medicine, and I like the challenge of piecing together fractures and seeing people with chronic pain do so well by doing replacements, and so quite a lot of satisfaction from that. How I ended up here in Cambridge, basically during my fellowship, which was I mentioned in one of my supervisors asked if I could cover some call shifts here at Cambridge because they were short at that time for some call coverage. And so I certainly accepted the opportunity. And interestingly enough, the very first call shift I did, my first surgery, the patient was from Newfoundland, the scrub nurse was from Newfoundland, I was from Newfoundland, and the recovery room nurse was from Newfoundland. And I can remember thinking to myself, where am I? It seems very bizarre. But I didn't realize that there was such a large presence of Newfoundlanders here in this community. As for the hospital itself, I really liked the feel of this place. It was a community hospital. People were very friendly and collegial, but it also had this academic aspect where most people had a subspecialty specialization. So I became very interested, and then when the opportunity arose that there was a job available, I jumped at the opportunity right after my fellowship, and luckily I was offered the position.
Oh, that is great. And just a reminder for those folks who have just joined us, could you make sure that you mute your microphone and so we can hear Dr. Martin. Thanks so much. And Dr. Martin, I'm sure I speak for others when I say we're so pleased that you came to Cambridge Memorial Hospital to serve our community. Now, presently, our orthopedic surgical team consists of 6 surgeons. So please tell us, what does a typical day of an orthopedic surgeon look like? And what does a typical day of a patient having orthopedic surgery look like?
Sure. Well, orthopedic surgeons, we're not in the OR every single day. Usually a typical week, we might have elective surgeries 1 to 2 days a week, a fracture clinic day a week, and office day 2 days a week where we see elective consults. But as for, I'll focus on a specific surgical day. Usually a typical surgical day for me will be 4 joint replacements, usually 2 hip replacements, 2 knee replacements. And we usually start off the day, I'll come in and assess the first patient at around 7:30. And by that time, the patient is already checked in by the preoperative nurses. And I will go over their history again, ask for any last minute questions, put a big initial over their surgical site and review the consent. And from there, that patient is assessed by the anesthesia team. They're also assessed by our circulating nurse. And then once everybody has assessed the patient and the patient is ready, then we all go to the OR. And one comment almost every patient makes when they come into the OR is, how many people are actually in the OR when they show up. They come in. There's 2 surgical assistants. There's the surgical scrub nurse, the anesthesia, the surgeon, the circulating nurse, the OR attendant. So there's a lot of people involved. And then once the patient comes into the OR, we do our checklist again, confirming we have the right patient and we're doing the right procedure. And we have all of our equipment we need, and the anesthesia has all their equipment they need. And then from there, the patient will get their anesthetic. And after the anesthetic, we prepare for surgery. And so we depending on what we're doing, if it's a hip or knee, we prep the patient and position the patient, and then we begin the surgery. Usually, surgeries take about 60 to 90 minutes, depending on how complex the surgery. And I actually took a couple little items here today to show you that during the surgery, for instance, a knee replacement, we usually size the knee when we open the knee up. We make our bone cuts, and then we have trial pieces. I'm not sure if you can see them here. We have some trial pieces that we use.
Can I just cut in for a second, Dr. Martin?
Okay.
For everybody, sorry about that, but for everybody to see what Dr. Martin is trying to show us, can I ask you to turn off your video, and then Dr. Martin will be full screen and we'll be able to see what he is demonstrating to us much better. Thank you very much. That should just be at the very top. You'll see a little camera icon, and just click on that. You'll see a bar through it, and you'll be off the video. Thanks so much. Sorry, Dr. Martin.
Okay, I'll carry on, I guess. And so during the surgery, like you said, we figure out which size everybody's femur and tibia are different sizes. So we have lots of different pieces that we use to help determine which size your knee is. And then we test and make sure we have the correct sizes. And then we finally open up the actual implants that are stored in boxes just outside the OR. After the case is finished, and the anesthesia is either reversed if they had a general anesthetic, then the patient is taken out to the recovery room, where they stay for about an hour or so, and then they're taken up to the surgical floor, where they're assessed by the surgical nurses and the therapists. And so that patient carries on that pathway, and then we start over again with the next patient, and we do this 4 times.
Wow, that's incredible. The 4 times in a day. And as was mentioned earlier, in January 2020, just before the pandemic, we opened our brand new Wing A, which includes 9 brand new operating rooms equipped with the latest technology and tools and items that you would use in your surgery. So, Dr. Martin, can you tell us, how has the new wing, and in particular the operating rooms, changed things for you and your department colleagues?
For us, it's been a huge improvement, especially for joint replacements. The OR that's designated to us is very large, and that's important for us because sometimes when we're doing some complex surgeries, there are lots and lots and lots of equipment, so everything can fit in easily in the OR. The rooms are big, bright. They have good temperature control, nice airflow to decrease infection, and we have huge monitors up on all the walls that we can move so that I can see the x-rays at all times during the procedure. So it's been a massive improvement in the quality of the OR status itself. So excited for the rest of the hospital.
And you mentioned the number of colleagues and people that are supporting your surgical efforts, and they can all fit in to the new ORs quite readily now, and have lots of room to move around. I imagine. Right.
Yes, for sure.
Well, it It sounds like the new ORs have been a very welcomed addition by orthopedics and other surgical teams. So I'd like to talk now a little bit about your patients and understand what are some of the more common reasons that patients seek your care?
For myself, where I have kind of a special interest or subspecialty in hip and knee, most of my patients are hip and knee related electively. And I have kind of two groups of people, the kind of younger sports injury individuals from like soccer, basketball, etc. They usually present with ACL ruptures, is quite common, or meniscal injuries or cartilage injuries. And so on the other side is the arthritic joints. So my waiting room is usually 20-year-olds and 80-year-olds, so it's quite interesting.
I would imagine. And are there any other reasons people may seek orthopedic care?
Yeah, absolutely. For most orthopedic surgeons, a big part of our practice is trauma. So basically how that works is that there's 6 of us orthopedic surgeons. Each day we take turns. Somebody is on call. So if somebody in the community gets into an accident or falls off a ladder or falls off a bike, they present to the emergency department. The emergency room physician will do the x-rays, and if there's a fracture, they call the orthopedic surgeon on call to find out what the treatment is. If it's something that's surgical, then we proceed and do the surgery that day, or if the OR is too busy, the following day. And if it's something that does not need surgery, then that will go into fracture clinic. And usually fracture clinics are very busy clinics. I'm sure some people online here can attest to that fracture clinics are usually quite overcrowded.
Right.
Lots of fractures.
A lot of fractures. So that's incredible work that you're doing, Dr. Martin. And earlier we mentioned that community dollars fund 100% of the equipment at CMH, and approximately $120,000 is on the list of equipment needs for the orthopedic program alone. So we want to bring up a picture of an example of some equipment, and I'll just wait till Terry can bring that picture up. And it looks quite interesting and quite a lot of bits to it. So can you explain for us what this piece of equipment or pieces of equipment we're looking at is, and how will it be used?
Well, what we're looking at, the top black item, that is our saw without the saw blade and without the battery pack. We use that instrument for every single joint replacement that we do. So it's used quite frequently. And then the one that looks like it, but it's upside down, that's our drill. And that piece of equipment, along with all the bits on the side, that's used for every single fracture case. So both of those instruments are used constantly every day here and every evening pretty much in the hospital. Wow. And both of these, I should mention both of these, they're nearing their end of life cycle right now because the battery packs are frequently going dead. So it's just constantly having to replace the charge on them. And they've become quite noisy, so they're reaching their end of their life.
I would imagine this would be a set that you would have to replace at a fairly regular basis, and I kind of equate it to having a car. The more you use it, the more upkeep and maintenance you need to do, and often the quicker you need to replace it as well. So I would imagine tools, orthopedic tools, would be very similar in that vein.
Yeah, absolutely.
And so tell me, what does the right equipment and tools matter for the work that you do, Dr. Martin?
I guess it's like anything, having the proper equipment just makes the task at hand much more achievable and certainly in a much more efficient manner. Like any project you do, if you have the right equipment, it certainly makes life much easier and much more efficient. So very important.
Great. And I mentioned at the beginning that we're really excited about CMH's future, which we share in our caring programs that celebrates our people and our programs. So what is the future of orthopedic surgery at CMH? And what would you like anyone listening to us this evening that may be waiting for a hip or knee replacement to know?
Well, the good news is we're slowly starting to open up the ORs once again. The hospitals are still near full capacity. So right now the plan for orthopedics and specifically is to focus on some outpatient surgeries. So fortunately for the orthopedic program is that we have already put in place an outpatient joint replacement program. And we did this pilot project actually before the last shutdown. And a number of people have gone through this pilot project, and it has been very successful. So we're very fortunate that we're going to restart that. That same-day surgery is obviously not for everybody. There's criteria, but at least we're going to restart doing some of these surgeries again to hopefully get the wait list, chip away at the wait list. And I kind of foresee that this will be an integral part of orthopedics going forward in our institution, that we can offer both inpatient joint replacements as well as outpatient joint replacements, depending on the comfort level of the patient and their medical histories.
And I just want to confirm that you're saying outpatient joint replacement. So people would come in and have the surgery, and on the same day they would be released from the surgery as well to go home and recuperate at home.
Yeah, it sounds pretty amazing, because at one time patients would stay for over a week, and then it was slowly a couple less days and a couple less days, and the average time in hospital currently for our joint replacement is just one night. I'd say about 85 to 90% of people generally stay just one night anyway, and the rest stay 2 nights. And so we started this pilot project, and a small subset of people can actually go home the same day, and they're quite eager to go home the same day, and they recover a lot better at home. The food is much better too.
That is really exciting. And, you know, there's so much to be excited about. What are you most proud of related to the orthopedic surgery program at CMH?
Well, just the ability to offer a wide variety of surgeries, including very complex cases. We kind of have all the subspecialties covered here for the most part at Cambridge, from foot and ankle, hip, knee, wrist, elbow, shoulder, all kinds of different surgeries that we can offer, and very complex surgeries that we can offer. We have a highly trained healthcare professionals here, including the surgeons, the surgical assistants, the nursing, therapists, anesthesia, fracture clinic technicians. So we have everything we need here to do a lot of surgeries. And people can stay right in their community to have these done. Yeah.
And that's great to hear. And you're surrounded by a fabulous team that supports you and what you're doing in helping our patients recover and get back to an active lifestyle. So that's wonderful to hear. And Dr. Martin, this is a little bit of a change now from talking about orthopedics and the work side of things. When you're not at CMH, what do you like to do on your time off?
Oh, well, I try to stay active and fit as much as I can. I enjoy golfing. I see Murray is on here. I've been on his front lawn more than once with the golf ball. I also enjoy biking and jogging. And in the winter, I mainly stick with ice hockey, but some cross-country skiing and downhill skiing when I get the opportunity. So basically anything active I like to do.
That's great. just don't want to see you in the downhill skiing into surgery. So I'm sure you're very cautious. And Dr. Martin, you've graciously agreed to be featured in our spring direct mail appeal that shares information about our orthopedic program. Is there any message that you would like to share with foundation donors on our chat tonight? And what does donor support mean to you as a surgeon?
Well, just that I'm very grateful that we have such a generous and caring community who really recognize the importance of donations to the hospital, so us healthcare providers can provide the care that the residents of this community deserve. So we're very, very grateful for that.
Great, thank you.
Great.
And want to thank you for your comments, Dr. Martin. And I see that we have received some questions from the audience. If you wouldn't mind, I'll present one question at a time, and you can answer their inquiries. So the first one is, how long do surgeries normally take?
So depending on what it is, so usually most hip and knee replacements that I do, this so-called standard non-complex hip usually takes about 60 minutes, and some of the more really challenging hip or knee replacements could take up to 90 minutes, and some of the revision surgeries, so surgeries that have either worn out or got infected in the past, sometimes they can take up to 4 hours. So it definitely does vary.
And what is, you mentioned hip or knee revision. What is a revision?
So revision means that the patient has already had a hip or knee replacement inserted at a prior date, and basically there's something wrong with it, whether it's worn out or became loose or became infected. Then redoing it the second time is a lot more challenging because you have to deal with bone loss and trying to get the hips stable with less muscle or with less bone. So sometimes you got to get a bit creative and build an acetabulum if you have to. So it can get challenging for sure.
Sounds like it. Another question that we have from the audience is, how long would a new knee or hip last once it's replaced?
So once it's replaced, it for the most part, the plastic piece that's in the hip and knee, generally that's the piece that typically can wear away. And since 2005, that plastic piece has undergone very good improvement. And so the data from 2005 to 2020, so that's 15-year data, suggests that the majority of these hip replacements are actually still functioning very good. So at least 15 years, but if we extrapolate that data out, because we don't have much data further, I suspect at least 20 years. But like anything else, if you abuse it or you do things you're not supposed to, then it might not last quite as long. But for the average, I would say 20 years.
Okay, that's good to know. And I think we have time for another question. How long is the wait time for a joint replacement at CMH?
So that's a bit of a tricky question just because of the pandemic and the slowdown. During the last shutdown, when we restarted, we were given the opportunity to try and do some catch up. So we were operating on Saturdays and Sundays and holidays, and just to try and ramp up and make up for lost ground. Right now, we've been stopped again for at least another month. So it's probably somewhere in the order of 7 months, I would assume at this point, but 7 or 8 months. But like you said, that outpatient program will probably be a little sooner because there's a lot less people on that particular wait list.
Good to hear. And I hope you'll indulge me in asking a question from myself to you, Dr. Martin.
Okay.
And yeah, okay, thank you. I wanted to ask you, what is the most rewarding part of your work?
Well, I think that when somebody, I've had a few people tell me this, that I give some people their life back, and with regard, and what they're referring to is chronic pain, taking away that chronic pain. It's very physically and mentally exhausting for people. And once you remove that, then people feel very free, and they feel much better physically and mentally. So that's certainly one of the most rewarding parts of my job, seeing people come back with a smile on their face, with less pain than when we started.
Yes, with less pain, mobility. I'm sure it must be very rewarding to know that that was, your efforts that has resulted in those life improvements. So that's great to hear. Thank you. Before we end tonight, I have just one more question, Dr. Martin, and I'll just wait for a slide to come up. Oh, sorry, there's more questions in our chat. Okay, sorry, hang on, Dr. Martin. I've just been advised there's some more questions in our chat. So just bear with me because we do have time. Okay, let's see. One comes from Helen, and she asks, how are you finding virtual care? During the pandemic, you likely have more phone calls than in-person visits. Does this work well?
It's definitely a challenge for orthopedics because most of our orthopedic is kind of hands-on, examining joints and examining, doing the physical examination. But I found a hybrid of some virtual and inpatient can be convenient. The follow-ups are much easier for patients over the phone, especially if they have to travel long distances. But even in the pandemic, sometimes it's imperative to examine people regardless, and that's what we've been doing. We tried fracture clinic a couple of times over MS Teams or Zoom when people were isolating, and it was definitely challenging with the spotty internet and internet cutting in and out and things like that. But like everybody else, we're just adapting.
That's what we've been saying, pivoting and adapting. You do the best you can, and glad to hear that that your orthopedic activities have done the same. We have another question in the chat, and from Tiffany. Thanks, Tiffany. And her question is, what activities did you do during your undergrad and master's to prepare you for medical school?
What activities, school related? Sorry.
Perhaps she means that. I would imagine she means that about activities during your undergrad and master's to prepare you for medical school. Anything in particular you can think of while you were doing your undergrad and master's?
Well, during the undergrad and master's, outside of schoolwork, I was involved in volunteer work, a lot of volunteer work, as well as a lot of different competitive sports. And I think that being on like a team sports really kind of sets you up in the future, knowing how to deal with people, interact with people, work as a team. Most of what medicine is working with each other and with team members, and that kind of goes back to the importance of sports and how important that is. So, and volunteer work obviously is very essential and important, and I did quite a bit of that in my undergrad as well.
And did your volunteer work associate with the medical side of things, or was it outside of what you were studying?
I volunteered both at the hospital, and I also volunteered with a therapy dog program. And so I would take a small dog to long-term care homes and go visit the residents at the homes. and everybody loves seeing a little dog, so brought some smiles to some faces. Yeah.
Well, I'm sure that has brought huge smiles to the face of the foundation staff helping me tonight. We are all, enthusiastic animal lovers here. So I know that's brought smiles to our faces as well. Great to hear that. And if there's any other questions, we have a few more minutes. We've got one more. Do you repair meniscus issues?
Yes. So the meniscus is a tricky little structure in that it doesn't have a very good blood supply. And so the younger you are, the more likely you can actually fix it and suture it back up. If there's any arthritis in the knee, then the meniscus can't really be fixed because the blood supply is not very, there's not enough blood for it to repair itself. So at one time, it was quite common to have your meniscus taken out, but we try and avoid doing that right now because we know that people actually do quite well with physiotherapy and leaving their meniscus in their knee because that's your shock absorber of your knee. So if it's torn and there's a possibility to suture it up, absolutely. I do those surgeries.
Okay, good to know. And are you involved in any research projects?
Right now, not actively involved. We did a lot of research through residency and through fellowship. But once you get outside of the academic center to do any good quality research is very difficult. So I have to say we have no active research studies going on right now, but always interested in collaborations for sure with my old team in London.
Right, to hear that they're doing research in orthopedics. And we have time. Are you willing to answer one more question, Dr. Martin?
For sure, we have time.
Okay. What would be done for a partial ACL tear at the time of a knee joint replacement? Does it just remain as is?
So for a knee joint replacement, we actually remove the ACL completely. And the prostheses are designed to have the ACL taken out. We try, there's different designs, but we leave the PCL. There's two options for the PCL. We could either leave that one in, or if it's damaged, we could replace it with the joint replacement. But all total joint replacements are designed to remove the ACL. Partial knee replacements, you must have the ACL intact.
Okay. Right, that answers that question from Jennifer. So, Dr. Martin, now I'm going to get to my final question. Just one more. And the slide that I had mentioned earlier, we're going to bring that up. There it is. And I notice, as everybody else in the audience can tell, you're wearing an Edmonton Oilers scrub cap in that photo. Mm-hmm. So now that you have moved to Toronto, just wondering if you've converted to a Leafs fan.
I find this very convenient to ask me this question the night after the Edmonton Oilers have been swept from the playoffs. But as a true Edmonton Oilers fan, we have short-term memory loss, and we're true ultimate optimists. So we will be back next year. So I'm a true Oilers fan, but if the Oilers can't win, then go Leafs.
Oh, and that was my answer. I have to admit, I'm a Habs fan, but however the series goes, I am going to be cheering for whoever takes this series. So excited, no matter who wins it. So thank you. So Dr. Martin, I know there's many people in our community who benefited from your surgical expertise and care, who are now experiencing an improved and more active lifestyle. I'm sure there's some folks that are with us this evening that are included in that group. And I'd like to thank you for all you do to care for our patients and enhancing our community's quality of life. Thank you, Dr. Martin. You're an important part of the Cambridge Memorial Hospital team, providing exceptional care in our hospital. Do you have any final remarks for us?
Yeah, thanks for those kind words. And I would just like to acknowledge the foundation for all of your hard work that you guys do constantly. And I would just like to thank everybody online tonight for their attention, and that we are truly grateful for your support and your generosity. Thank you.
And I will echo Dr. Martin's words, say to everyone who is participating in this virtual chat, thank you so much. For more information about Dr. Martin and our orthopedic team, we will provide you with a link into our spring direct mail appeal. I believe it is there now in the chat. We will also share with you a new video on orthopedic surgery as soon as it is ready for distribution. So thank you everyone for joining us for our conversation with Dr. Glynn Martin. It was a pleasure. Have a great evening. Good night.